So one of the main reasons to start the fellowship was the realization that a lot of fellowships in this day and age have evolved into maybe less of a mentorship type program and more of a continuation of their residency. Our philosophy is that we offer more of a mentorship model, almost an apprenticeship, whereby we have them operate from day one. We have them seeing patients from day one. And we think that combination of a real-world hands-on clinical experience with a lot of experience in the operating room has these folks prepared to practice from day one when they leave.
The operative experience has been phenomenal in every way. I think the biggest surprise for me was probably the complexity of cases that we get. Very early on, I felt prepared to go into practice, and largely just because of the variety of cases that we have seen.
You operate so much that you don't really worry about making as many mistakes because you have the guidance from master surgeons like Dr. Morrey and Dr. DeLee from the beginning. So you get to do the cases from day one. To have a co-fellow that you can bounce ideas off of and work together pretty closely has been really beneficial. And it is a single attending model, but it's almost like the best attending that you could hope that you work with, and you get to work with that attending for the entire year. You're not rotating off to a service that you have less autonomy or people nitpick at how you're doing things.
Your relationship with Dr. Morrey and Dr. DeLee is more than just attending and fellow. It's really a lifelong mentorship. We've gone fishing together, and Dr. Morrey and Dr. DeLee want to know me more than just who I am at work.
This place is a hidden gem in regards to fellowships. You have our big name physicians here that aren't a part of an academic institution like they normally are. The autonomy you get, but also the big names that you can be associated with from this fellowship has been, I think, one of the most unique experiences because those guys are typically related with institutions. There's quite a complex business side that you don't learn in residency that he's more than happy to go over with you as you train in regards to billing and managing a practice and people in your practice.
Medicine's a business. There's a business element to running a practice, to being in a practice that oftentimes is not covered when you're a resident and may or may not be in fellowships, but most fellowships don't really dive into that aspect of one's practice. So when they leave the fellowship, they are encouraged to reach out to us with cases, with questions, and they're taking on a lot of challenging cases. There's nothing more rewarding than having them send me preoperative x-rays, talk about their plan, discussing it. They're taking on very challenging cases almost immediately. They're not shying away from these things. Their thought process is great, but I encourage them always, reach out, don't hesitate. Once they leave the program, we're there for them no matter what.